Hi, this is Dr. Dukes with Body in Motion here in Denver, Colorado. We're going to go over a couple of treatments I use mostly on shoulders, even the lower back, but in this particular video we're going to do something on the tib posterior and the medial calf. So this is really involved in balance and stuff like that for patients. So these peroneal tendons are the post-tib, so peroneals on the outside, post-tibs on the inside. Depending on the person's form and the way that they run, it's going to lead to having some issues here if they overstride or understride. But at the end of the day, this will also have an effect on plantar fasciitis, Achilles tendonitis, even ankle sprains. So what we do is I always use whatever tool you choose to use. This is a Graston tool, but I always like to do it with movement. I think when you get either the body loaded with weight and then you make that joint move or that tissue move, you get a little bit better results. So what we're going to do here is I'm going to have her move her foot back and forth, kind of going into inversion, eversion, and then we're going to gently go over the tendons and muscles just medial to the tibia. So it's not a lot of pressure, but she is noticing it, and the movement gets a lot more bang for the buck, so to speak, so we don't have to linger too long. Definitely like to go in each direction and find those areas that are the most tender and maybe spend a little bit more time on those. And then you can also even do this with them pumping the foot forward and back, working different muscles. But you can use this, like I said, in various areas. Most of the time where a muscle is going from a muscle to a tendon is where we're going to get the most use out of a tool like this. Then there's another option. You can use some percussive and vibratory type of pressure. And this is really nice in the fact that you can get them to still move if you want. I usually start out with them not moving on the lowest setting, and then I will gently go through the tissue that way with no movement at first because the vibration is creating quite a bit. And then you can have them start to move the foot back and forth the same way as they were. Go ahead. And then as they're moving through that plane, that little percussive nature of it will draw some things out. So this is a great way to loosen up a tendinosis, tendonitis type thing on several areas of the body, but it works really well in the lower leg and, like I said, in the shoulder and the lower back. But I do think the key here is making someone move while you're doing that tissue work. So if you have other issues with feet, calves, whether it's for running related or even swimming or shoulder problems, this is all something that you should be looking into before you go to more drastic measures. So give us a call if you have questions.